This is a brief presentation about recording our clinical activity. In rural New South Wales, we're at a distinct disadvantage with less clinicians, both medical and non-medical, working out here in the country. Our attempts to record our clinical activity help to secure additional funding, and certainly the funding that we're entitled to assist the people we serve. In this brief PowerPoint, I'll explain how we need to record activity to reflect what we actually do and to ensure that we continue to get the resources we need for people here. If there's no other clinician with you as the doctor seeing a patient, you absolutely must record your clinical activity. And just check in with the clinician that they're actually recording that you're in the room. Not all clinicians will do so, particularly if they're locum workers. There's common misconceptions about why we should actually record our activity, and that we're actually very expensive data entry people. In actual fact, we're really accurate data entry people, and this was demonstrated by a group, Intermountain Healthcare in Utah, and it showed that when doctors enter their data, it provides very, very accurate and helpful advice for health systems. Have a look at that link if you'd like to. Now on PowerChart, it's quite a busy system and you might not know where to look. And sorry, this image is a little bit blurry, but right up the top, you'll see there's a ribbon and it's got lots of different things there. A little bit more closely, you'll see that there's a button called Ad Hoc, and that's the button that you press to open the function to record your activity. Pressing Ad Hoc opens up this screen. A closer look, you'll see down there, there's a button and folder Mental Health button, and you'll see Activity. As such, and to the right of that, you'll be able to tick the box Client, and then scroll over to the right and press Chart. That will open up a chart with a series of drop-down boxes which you need to populate. You'll also need to populate the diagnosis box. Populate that the person has presented, that you're dealing with mental illness prevention, for example, if that's relevant. That it's the particular team responsible, depending on which team you're seeing, that the client presented or did not, this may be, and the number of clinicians present. You'll also need to choose the particular location type. I'd like you to add the diagnosis. There may be other diagnoses there, and you may need to add additional diagnoses. It's really important that you add all common mental health, drug and alcohol comorbidities. In combination, these add additional and relevant funding that's justified for the person you're seeing. And so there's an example of the diagnosis that I've added, and that's my final. And you need to add the, which is the primary diagnosis for this patient. And then you tick a box up in the corner, which is to sign the form, which will take you to the next screen for a second. You'll also need to say what sort of activity you've done. So that might be clinical review, or it might be a missed appointment, and there may be some administration time. So you need to populate that and the duration of minutes as you see fit. This is a deeply intuitive area, as I've mentioned to the right there. It makes absolute sense. And then again, you tick complete. So to summarise, this only takes a few minutes for each patient, and it ensures a high standards of governance and care. Anyone who thinks this isn't a good part of care is mistaken, and it allows us to plan for each patient. Sometimes when we open and close folders, the diagnoses of patients will be lost, and at times that can seem to be a little bit annoying and you'll need to populate them again. Unfortunately, that's part of our system. and you'll need to just navigate that as you see fit. If you're unsure how to do any of this, or you've got any glitches with the system, I'd love you to see Lucy Rolak or myself, and we'll give you a demonstration. Do make sure that your fellow clinicians are actually populating this data for yourself if there's another clinician in the room. We're going to have a focus on making sure we enter all this data so that we give people in Dubbo and the northern regions of Western New South Wales Health the best chance at attracting the funding that they should have for this region. Thank you.